All right, welcome everybody to the July 2025 LGBTQIA plus Commission meeting for the city of Pittsburgh. We're going to get started with some attendance. If you are here, please say aye. Leonard Orbovich,
Aye.
Catherine Calhoun,
Aye.
Julian McLean,
Aye.
Richard Parsakian,
Here.
Shanti Porter, Sarah Rosso,
Aye.
Derek Tynes, Guillermo Velasquez. He said he might be about 10 minutes late, so we can pass over. Kevin Carroll,
Aye.
Barb Warwick is absent. Donald Donovan
Aye.
and Alexander Gray.
Aye.
Last but not least, Anne Marie Ellison.
Aye.
Wonderful. We have met quorum. As I said previously, I came down with a cold and I was going to finish the minutes within the last few days and did not get the chance to. So that is my bad. We're a little behind on minutes. I will make sure that those get sent out. We did not have any public comment. As usual, people are allowed to leave public comment on the city's website for the LGBTQIA plus commission, but I have not seen any in the last month, so I have nothing to report. Moving on to officers and standing committees, do either of the co-chairs have any reports? Seeing none, I will move to outreach coordinator report. Is there any report for the outreach coordinator?
I have nothing at present.
Wonderful. Okay, moving on. We have a quick report from the special committee specifically for Outfest planning. Did want to let everyone know that CC was so wonderful to be able to connect me with the folks from Hazelwood Green. I have a meeting with them tomorrow, and I have set up some meetings with public safety to have a discussion with them on the safety plans and any other resources I can utilize from the city for Outfest. And I will be sending an invitation for the next planning committee probably Thursday. So look out for that. If you are available, that would be wonderful. And if there are any questions surrounding Outfest, feel free to speak about them now. All right, seeing none, I'm going to move into unfinished business. So as I've kind of created a new item in our agenda that just has commission recommendations and then kind of a short tag as to what recommendations we've had. So we have two recommendations around unisex restrooms. We have a SOGI training recommendation about us ensuring that there are folks from HR that are trained in SOGI. We have a recommendation from last month about free menstrual products as well as reproductive leave. The short way I'm going to kind of summarize this is I am slowly but surely making appointments or meetings with those folks. Everybody's on vacation in July, so it's a little bit of a slow time. But I will be meeting with folks from HR as well as I'll be talking to Barb Warwick and our Office of Management and Budget about the financial impact of those things so that we can start to move forward with those recommendations. I will continue to keep everybody updated on what's going on there. If there are any questions regarding those, please feel free to speak now. Seeing none, one kind of separate recommendation is the literal edit or amendment, excuse me, for the LGBTQIA Commission's ordinance to make sure that y'all have a person in my position in the future. I have already amended that and sent it to our policy director to oversee. And we are currently just crafting that legislation to be able to present it to council. We'll probably be able to do that in the next 2 or so weeks. So wanted to make sure everybody was aware of that. That should be moving pretty quickly just because it is a very simple amendment to the ordinance. Moving on for new business, which is really our big thing for this month, we have some wonderful folks from AIDS Free Pittsburgh. I want to give a special shout out to Julian for introducing us. They have a wonderful presentation for you all to talk about some of the work they've been doing. And so would somebody from y'all's team like to present? Because I'm feel free to be able to present now and go forward.
Yes, thank you so much. Hi, I'm Cal Wilkinson, they, them. I'm the project manager for AIDS Free Pittsburgh. Thank you so much for the opportunity to present today. I'm actually feeling under the weather and calm down, so I'm going to turn it over to the rest of my team to introduce themselves and proceed with the presentation. But again, thank you so much, and we hope to hear from more of you moving forward. All right, cool. Take it away, Jay and Hazel.
I'm Hazel Azier. I'm the Community Outreach and Engagement Coordinator at AIDS Free Pittsburgh.
My name is Jay, and I'm an intern with AIDS Free Pittsburgh. And Hazel, if you want to get us started.
Yes, I was about to. So, AIDS Free Pittsburgh, we started December 1st, 2015. And it's initially started out as like a 5-year project, and it's just blossomed and grown since then. So, going into it, our mission is to achieve an AIDS-free county and reduce the rate of new HIV infections by 75% by year 2030. And our vision is that we envision a community where a new HIV infections are rare, people living with HIV receive the care they need, and young people can grow up in a world without AIDS. For a little bit more education, AIDS is late stage HIV. So if we can eliminate the process of developing late stage HIV, we know we are doing good in our vision. Now, our value statement. AIDS Free Pittsburgh is a public health movement to end the HIV epidemic in Allegheny County by 2030. AIDS Free Pittsburgh is a collaborative initiative comprised of government agencies, healthcare institutions, and community-based organizations that strive to support and improve the care of people living with HIV as the communities most impacted by HIV. Because if we can get people aware, we are doing what we need to.
Oh, yeah. So unlike a traditional direct service agency, AFP works through what's called a collective impact model. And that means that we're not the ones doing everything ourselves. We're bringing people together and organizations together to align, coordinate, and scale up what's working without duplication or gaps. And it's built on 5 key components that really make it work. First being our shared purpose of ending the HIV epidemic here in Allegheny County. Secondly, our shared progress measures that let us agree to standard data indicators so that we can track data for deeper insights really than any one of us could gather alone. We have unique programs that mutually reinforce one another, all again towards this same common agenda. We have routine communication through committee meetings to regularly share updates and address challenges, and a backbone organization, which is where AFP comes in. We're the ones making these connections across service providers and keeping everything moving towards our common goals with our partners.
So here are a great majority of all of our partners that you'll see us partner with throughout the county. Many of them have services that are funded by Ryan White dollars. Ryan White funding, I should say, is a program that helps support people living with HIV so that they don't have to struggle with certain social determinants. And it helps pay for some of their healthcare as well. Well, not some, a lot of it. And again, AIDS Free Pittsburgh is fiscally supported by the Allegheny Singers Research Institute, AHN, and UPMC Presbyterian Shadyside, and is managed by the Jewish Healthcare Foundation.
We are structured in a way that brings together all of these leaders from across our partners. At the top being our advisory committee. This is our largest decision-making body with representatives from the leadership of all of our partner organizations. Our other 2 specialized leadership teams are the executive committee, which includes senior leadership from some of these major health systems, providing more high-level guidance, and then our Community Advisory and Action Board, which brings together local HIV advocates who represent really the community's voice. And then 4 more subcommittees there at the bottom are Prevention and Care Subcommittee, Data and Evaluation, Outreach, and Policy and Advocacy, doing some of these day-to-day operations, and membership in those is all voluntary from our partners. Our Policy and Advocacy Committee, excuse me, is our newest one. Really excited to be branching into this kind of area right now.
So our 3 strategies that we consistently participate into in the epidemic are normalizing HIV testing. This is to increase the rate of routine screening for HIV in medical settings in accordance with the Center for Disease Control and Prevention in the United States Preventative Services Task Force guidelines. We want to increase the access to PrEP, increase awareness of pre-exposure prophylactics or PrEP in the community, and build capacity for healthcare providers to identify eligible patients and prescribe PrEP. And we want to continue to improve linkage to care. This is to use established relationships with the medical community to ensure that people diagnosed with HIV are quickly linked to high quality care, facilitating faster treatment for those who need it.
So again, while we're not directly providing the services ourselves, we're doing a lot behind the scenes to support HIV care and prevention altogether. On the data and evaluation side, that looks like collaborating with health departments, local health plans, and Ryan White clinics to collect and analyze data on HIV testing, prevention, care outcomes. And then we also run our own community surveys, most recently a PrEP awareness survey to answer new questions. And then we're sharing the results of that. With the data we collect, we publish the results and share findings for program decisions and policy, but also more recently, we've been returning this data back to the communities that it came from. We're hosting data walks, which are these interactive events where community members can see and respond to the data in a really accessible way and have a voice in how that data is interpreted. On the patient and provider resources side, we create and distribute tools to help both patients and providers navigate HIV prevention and care. For patients, we have our HIV service navigation hotline, where people can access one-on-one support in finding resources for HIV prevention and care local to them. And they can also explore these resources on their own time on our website. We host a resource directory where people can find testing, find PrEP or pre-exposure prophylaxis, and all sorts of other resources available to them. On the provider side, we offer continuing education and training. We have our PrEP toolkit with information on how to prescribe PrEP and support patients through the process, and our rapid linkage to care guide with dedicated phone lines at each clinic that helps people newly diagnosed with HIV get into treatment quickly during a really vulnerable time.
So we also provide a lot of activities for community members and various organizations to come participate in. We actively table at various events throughout the year. Like you'll see us at anything from a festival to a health fair. We try to get the word to everyone. And we consistently post on social media various bits of information that's related to data or upcoming events that people can participate in. Or we just tell them about things that's happening in the world. Like, hey, there's a new bill that might be coming out, and we need to ensure that you're aware of your resources and where they may be going or this thing, et cetera, et cetera. And then we actively put a lot of effort into our media campaign that's with JHF. You'll see billboards across the state. You'll hear us on the radio. You'll see bits of literature. You'll see pieces of merchandise and other like little cool things. And yeah, it's really cool. I hope that one day, if you haven't already seen one of our ads, that maybe you'll notice it now when you're driving down the street, or if you open a dating app, or if you even look at a bus shelter.
And then I wasn't sure how much of tonight's presentation that you all as the commission have ideas on what you'd like to learn from AIDS-Free Pittsburgh. But we also have some ways to get involved that we're sharing. We have our upcoming event celebrating 10 years since our founding later in December around World AIDS Day. We've got our newsletter. We've got ways that you can request resources or AIDS-Free Pittsburgh's presence at an event. And of course, our website is there for you to explore resources and view data. I'll share the link to the website in the chat, but any questions at this time?
Thank you all. That was a great presentation on like the overview of AIDS Free Pittsburgh. And I particularly was interested for you guys to speak to this commission around the advocacy commission or committee that you all are starting and some of the initiatives maybe concerning that. And then I know that there's been like a rebirth of ACT UP Pittsburgh and two, and I just wanted to know how like the commission could lend to those advocacy efforts because that's like what we do advocacy, like policy making and try to get some local, I guess, change making done. So however we can assist with, I mean, the elimination and prevention and reduction of HIV and AIDS, I mean, I'm sure that's what we'd like to know how we can help with that mission.
Yeah, our policy and advocacy committee is really just getting started. I think we've had all of one meeting already so far. So now is a really great time to be kind of at the start of this collaboration and what that looks like moving forwards. I think the group is ready to go with things really quickly. They're still kind of learning their focus, but it's a group that's very motivated. And definitely with an intention to focus on local issues. I think there's room for collaboration there.
Thank you. I appreciate it. That was great. And then, yeah, I just didn't know if there was like, I know that because I was on that.
Yeah.
That meeting. And then I wanted to, I know that we've talked about like some specific, and I just like to keep things just like on our threshold and just for our foresight. Like I know we talked about some specific policies and right funding and stuff like that. So and if we can like share those notes and like how we can like I guess like I said, be a vehicle to like, I don't know, advocate for you guys to advocate for those things. That's like kind of what I was thinking. Yeah. Thank you again so much.
I can speak a little more to the policy and advocacy work, Julian. Uh, so, you know, with anything AFP, we are always welcome to more partners and folks joining our meetings. So if anyone's interested in doing that, like feel free to reach out to us at this email, or my direct one is wilkinson@jhf.org. Yeah, like Jay said, I think, you know, we'll see where this policy and advocacy committee goes. At AFP, we're really proud of like when we hear partners in our network say, like, hey, we could use some space to talk about a specific topic. You know, that's where we try to step up and fill those gaps and, you know, create the space for those conversations. I know one thing we're looking at right now is offering like an advocacy one-on-one training to folks in our network. So we're looking at bringing in some attorneys for that at sorry, I'm also feeling under the weather, so I'm like a little foggy. But the group is called Boulder Advocacy. And so we're looking at scheduling them in September. And again, just like offering a free, like 90-minute session to our providers with attorneys offering the session as a way to like help people understand what maybe their restrictions are in advocacy as nonprofits, et cetera. But also then, the flip side of the coin there is to like help people feel confident in engaging in this work. Because like we're all a little stressed out. There's a lot of unknowns, and again, like the collective impact model, collective voices sometimes are a really good avenue for this. So, excited. But yeah, if anybody else wanted to get involved, like feel free to reach out on that. And yeah, we see organizations like ACT UP popping up again. I know that a lot of staff at many of our partner organizations are involved in that work. Even some of our partners hosting the meetings. So, yeah, just really interested in kind of learning from each other and how we can all play, our various like roles in the advocacy and policy, kind of struggles, fights, and potential wins that are coming. I hope that helps.
Yeah, that's great. Thank you.
Yeah.
Okay. And then sorry for interrupting everyone. If you have any questions, please feel
Hello, everyone. Thank you for this wonderful presentation. This is Richard Parsakian. I've been very involved in the AIDS awareness for many, many decades, coming out of Pittsburgh AIDS Task Force. Originally, I was on the board, and now it is known as Allies. I also work with Planned Parenthood. And my question is, will you be able to, and it's wonderful to see that you're partnering with them also in your list. Would you be able to, instead of reinventing the wheel, be able to learn from them their struggles to make an organization viable in this community, especially now that our funding is being cut back in so many ways? I know that the Ryan White funding is very secure right now, but a lot of the organizations, especially I have friends that are losing funding and research and AIDS research at Pitt. There's a lot of concern in our community who have fought for this awareness and trying to make this scourge on our community sort of let the community know how to deal with it, but also how to live with it. And living with it is so important. And I'm just, curious about, partnering and learning from other organizations that have gone through this already. Anybody?
So are you asking us like how are we delivering services
No,
or
no, no, no. Are you, my question basically is because there are organizations that have been around for 40 years, have you been able to talk to them and get a sort of sense of how to navigate what you're trying to achieve in this organization that's been around for 10 years?
so we regularly communicate with our partners like at least I want to say at least once a month, like a major meeting at least once a month. But like there are miniature meetings that we have leading up to like events and that we have following events and that we communicate about like if we wanted to start a new program, if we wanted to develop a grant or something else that the collaborative needs or like the collective of our partners. Like we consistently talk with them all the time. And most of the things whenever we converse are about ways how to do things differently and do things better.
Okay.
Like that's probably like the I think we call it like a rosebud thorn exercise typically, and then we'll like pick a few roses or a few things that we felt went really well. And then we'll pick some things that were like okay, or some buds, as we say. And then we identify as many thorns as we possibly can because we don't want the thorns to keep happening.
It
But
sounds like
yes, that's
you're looking for things that have been missed in terms of
yes.
how we, and I think that's really important to not miss anything. And having an organization, any organization that fills in the gap, could be the community that you're working with, the community that you're reaching out to, how you do it, where you do it. I think those are very, very important discussions. And I've been aware of your organization for many years, so it's not that I'm new to this. You know, there are very few organizations that can sort of exist in Pittsburgh without me having some communication with the organization, with the leaders and the executive directors. So congratulations on 10 years. That's a huge achievement, especially what is happening now. Um, I was in near Oakland today, and I saw a huge contingent of ACT UP leaders getting ready for a visit to somebody at CMU. And so I was heartened by seeing them. I knew they were going to be more visible, but it was wonderful to physically see them uh, getting ready to march on misinformation, let's say. I'm being very kind.
I do want to say, if I can, speak to the example that you gave for filling in the gap. And for AFP, I think that collaboration around like World AIDS Day and Black HIV Awareness Day, instead of each individual organization, coming up with their singular event, we've had collaboration on trying to have some singularity in that. And I think that hasn't necessarily been existing over the past couple of years. Well, since I've been doing this work for over 15 years, we've all had our own separate World AIDS Day event. We've all had our separate Pride events and things like that. And the focus on, like I said, singularity and filling in that gap to make sure that there's like one band, one sound. I think that's where AFP is stepping in. So for that clarification. Thank you.
Julian, I think maybe, do you think that the commission could be the, I'm going to say the collector of organizations to have one voice for December 1st?
And then, so we have specificalities, I think, about like that when we're thinking about LGBTQIA perspectives in a whole. And I think HIV and prevention is one of those aspects. So I don't want to say we're going to collect all the organizations for HIV or for STI prevention or anything like that. But I think it's important for us to, I mean, just like AFP collects a list of people doing the groundwork and people on the boots on the ground for everything, for housing, for HIV, for food depravity, for the issues that are periling the LGBTQI community. I think we talked about this as well as having like some sort of directory, but I think that's great. But especially around like the I want to focus on advocacy around how we can change policy when it's looking at HIV and STI prevention and stuff like that, or people that are, like you said, living with it and their quality of life. And so I think that we do need however we can assist and be a vehicle to kind of propel people's voices to make sure, well, this is from the mayor's office as well, that is also um, kind of confirming this message or kind of reverberating it, how important it is. I think that's like where we stand and how we can help as well. And that's what I was kind of looking for as well. If there's suggestions from AFP on upcoming initiatives and advocacy and stuff like that. I know that you guys said the group was still getting started, but like we can, well, I think that we have a place to be like a microphone as well. So our community is affected by HIV and AIDS. And so it's a big part of what we should be doing as an organization, I think.
Sarah?
Thanks, Hazel. So I just want to kind of contribute from picking up off of like Richard's comments and other things. You know, one of the things that I would like to see, and I think this warrants some discussion and figuring things out, is just how we can, I think in terms of how we can best support from a commission perspective, is often like amplifying where there are policy opportunities, right? How can we collaborate and check in? So where there are things that are impacting people living with HIV, how can we be a conduit to councils, to the mayor's office, et cetera? Like, how can we broker that? I think in terms of AFP's role in the community, I think they've done a really great job of bringing together the key voices who need to be at the table and has been guided and influenced by that. That has happened really successfully. So Allies has been a huge part of that. UPMC and AHN have been a huge part of that historically. So I think from that perspective, like I don't know exactly how we can best do that, but I do think we have a role in listening, like participating in some way, hearing what's happening at the policy committee level, and then helping advance things that are relevant for city government, and even perhaps lending our voice to things that extend perhaps just a little beyond city government, to be able to make sure that we're doing all that we can to improve outcomes for people living with HIV in our community, which is absolutely like a key part of what we're trying to do as the LGBTQ plus commission.
Correct. And then, like we said, putting our feelers to the ground, like if there's like some sort of citywide or some sort of policy that has changed and that is affected by like care today, like people are being kicked out because of their HIV status, and that's some sort of rental discrepancy, or I don't know how to put it into perspective. But Sarah, you said it beautifully. But how can we affect policy and advocacy for the people that are living with and affected by?
Yeah, and especially if there is something new, like new trends that have developed that we don't know about, because you have direct contact with the community and so on, that it is necessary that is protected. What is it that needs protection, that at least for within the city limits? That's where we as a commission can push anything, to make sure that people get certain level of protection, because all of this has been an evolution of changing things. So I think that's the message that we want you to have in mind.
Mm-hmm.
I'm sorry, I'm jumping in one more time. I apologize, but I think the other thing, and I don't want to speak too much to this because we have some other representatives and folks with more expertise than I do. But Julian, as you were saying, like housing discrimination and other things impacting people living with HIV, I think helping, strengthen the knowledge and relationship with the Human Relations Commission for the city of Pittsburgh. And then as the county edition of the expanded Commission on Human Relations kind of gets its position potentially funded, right? I think those are other opportunities. So I'll pause there and let folks jump in. But I think when we're talking about discrimination, there's a little more clarity in terms of where protected statuses fall for people living with HIV. So it's a little stronger than even protections for LGBTQ folks across the region and across the state. So that may be a good opportunity to let folks know like how they can file a complaint, build a relationship there, like linking those resources together from that policy and follow-up perspective. So.
Great.
Yeah, Sarah, I feel like you're reading my mind over here. I'll definitely let Kevin jump in if he has anything to say since he's literally from CHR, but definitely a lot of what it comes down to when folks are experiencing discrimination, HIV status is definitely going to be included in what the city protections are. Not everybody would necessarily be knowledgeable about that or know where to go if they're experiencing housing or other forms of discrimination like for city services or accommodations. But those are things that obviously we want to be we want people to be more aware of and be able to access as much as possible. I think,
Oh, sorry.
oh, Kevin, please go ahead.
I was just gonna say, HIV status is like not explicitly a protected class, but I believe, based on like my knowledge of case history at the commission, it can be like medical records. It can be under like a disability status for a claim, and they cannot file with HUD. HUD is not taking like LGBT complaints anymore, but they can file with the city if they are within the city limits. So they can file with us for that.
Thank you, Kevin. I appreciate that clarity. And that's exactly what I mean. You know, somebody even inside the city might not know that if they're experiencing that kind of discrimination, they can still go to CHR with some of those issues. About some things that were being mentioned around advocacy, policy, I think we were all kind of dancing around the right thing as far as if anything that AIDS Free Pittsburgh is doing around advocacy or policy recommendations, et cetera, need, you know, more of a bullhorn, need support, want connections to the mayor's office or city council, since to pass legislation locally, you do need either the mayor or somebody from city council to introduce it. There's somebody that sits on city council on the LGBTQIA plus commission. She is not here this evening, but she has been a phenomenal ally to the kind of work that we want to see to make our city more safe and welcoming to the LGBTQIA community. And that definitely is going to include the kind of advocacy efforts that y'all are working on. So if there's any way for us to advance them and support them, we're more than happy to do so. I would also say, and this is something that the commission would have to vote on, like formally, but I'm more than happy to have AIDS Free Pittsburgh's resources on our city website, or like a link to your website to easily get there if folks need more resources. But again, I will leave that up to commissioners to decide upon.
Thank you for that. Yeah, as soon as and then we'll wrap this up so they can but we can vote on, I think, a list of, like we were talking about, like I was telling Richard, a list of resources for a bunch of things. But yeah, I think like that's a good start, is making sure like the citywide effort to end HIV is a resource that we could definitely project. Okay. But thank you all. Okay, AIDS Free Pittsburgh.
Yeah. Thank you. Thank you for your questions. Thank you for having us here this evening. I think we've got a lot of areas in which our work aligns really closely, and I'm excited to see what that looks like next. So thank you again.
Thank you. Thank you.
A big thank you to Jay, to Hazel, to Kel for all coming out and presenting and informing all of us and keeping us very well educated about this incredibly important issue. Thank you very, very much. And we're very excited to partner with you in the future. Moving on, any other questions, comments, thoughts before we move on to announcements? All right, I had a pretty quick announcement just to make everybody aware that Pittsburgh's Black Pride is going to be July 22nd to the 27th. I will not be able to table there. I'm going to be away for that, but I did want everybody to be aware of it. And I will try to drop off some resources if we're able to get them printed prior to that. But if there are any other announcements, feel free to speak now.
Adriana, sorry, that took me 5 minutes to find the unmute button. So
that's okay. I always try to give it a good minute.
I appreciate the long pause today. So two things that I thought may be worth considering, and we may need to add this as new items, new business items to a future agenda. But I did want to talk a little bit about two events that are being planned that I thought would be relevant for the commission to be involved in. in some form or capacity, and it can be official or unofficial. But the first is actually an event that we're loosely starting to plan for the fall with the City of Pittsburgh Commission on Human Relations. So we've been working, we had a quick meeting with Rachel last week to talk about having a community forum to share more information and disseminate that information. So that's something that's happening at Hugh Lane. Date sort of to be determined, but we're looking right now at getting a group of stakeholders together to finalize dates and information to share that. And like I said, I think if you're looking at key partners, I certainly want to make sure that there's space for the commission to participate in that. And then the second piece that's similar to that is that every 2 years, there's a statewide survey called the Health Needs Assessment that collects data from LGBTQ folks across the Commonwealth. And those data collection efforts are then disseminated within community. So there will be opportunities in the future to participate in the actual survey data collection process, which I think we should keep on our radar. But we're going to be hosting with the data researchers a dissemination event for the Western region. And so I wanted to put both of those on the commission's radar and just see, at what level or capacity there may be interest in either partnering or collaborating in some capacity. I know an official partnership, of course, would need to be decided and voted on. But as we move forward to that early fall time, I can't believe it's mid-July. It'll be here in like 5.5 seconds. So anyway, with that, I'll pause.
I mean, initially, I think they both sound like phenomenal ideas. I especially when you're talking about the kind of forum that you're doing with CHR, I don't see any reason why we wouldn't be able to support officially as long as the commission votes in that fashion. Same with the health needs assessment. And obviously, I can imagine that anyways to increase the awareness around the health needs assessment and ensure that as many of our community members as possible are taking it. I can't imagine commissioners not being in support of that. So on the easy side, I think that there shouldn't be any concerns with being involved. But I'll leave some room for other commissioners to speak on that.
Let's put it to a vote right now if we can. And then I don't know how to frame the motion, Sarah. If you just want to say, can the commission support these two events? I don't know how to frame it, but
I think it's
I'm
motion.
Go ahead, Adriana. You started. Go for it.
No. I can't even make a motion. Go ahead, Sarah. It's okay.
Yeah. So like I said, I didn't know if we wanted to table this for next week, but if we want to go for it now, I'll make a motion to request the commission's official collaboration on both the community panel with the Commission on Human Relationships and the health needs assessment data to make it simple. If folks want to debate it or split it, we can do that later, but I'll make that official motion. Do we have a second?
I second that motion.
All those in favor, please say aye.
Aye.
Aye. Aye.
Aye.
All those opposed, please say nay. The motion is passed. All right. Well, very excited to be involved. That'll be great. Sarah, feel free to include us on any of those future calls or any event planning or wherever you think it would be appropriate for us to kind of hop in and support y'all.
That's perfect. Thank you so much.
Thank you. Any other announcements? Please, Richard.
Just really quick. The project that I don't know if did our commission or could have been the advisory council talk about the Mosaic housing project in Oakland, the LGBTQ plus senior housing. I was contacted to give input to one of the artists. Well, actually, there's two artists that have been commissioned to create artworks to represent our community. And I will be giving input in terms of historic photographs, ideas, and that. I am also having Billy Heilman contact them since he's sort of like our history photographer of almost all of the marches over the years. So they want to have a representation, but not in words, but more of visual ideas of our community over the years. There's an interior mural project, and then there's an exterior mural project. And they're both queer artists, which is very good. So it's part of the um, uh, public art um, uh, networking, and I think it's really good that we support what they're doing. The building is, if you've gone by on Craft Avenue and Forbes and seen that the construction is moving along very well. So I'm very excited to see what happens, and have a small part in sort of teaching the children, let's say, as I say, um, what part of our history, what our history is, and what the elders have gone through, so that all of you can stand on the shoulders of the elders, is very important to remember.
I couldn't agree more, Richard. Thank you so much. And I'm very happy to hear about your input for the mosaic apartments. And Philly did a similar kind of LGBTQIA senior housing in their neighborhood when I was a teenager, and it was an incredible thing to see in the community. And I'm really happy that to see that happening in Pittsburgh, and to hear that you get to be a part of that in a significant way. So very, very happy to hear that, and I'm sure the whole commission is in support. Uh, are there any other announcements?
This leads me to a question. I don't know if we got the social media logins, but like
Oh,
even if we don't like support, I mean, I don't know if Richard, you're asking for our official support, like to put into a motion to like be an official supporter. Because we could do that.
No, it's more of an awareness of,
Okay.
yeah, no, it's
Okay.
like in terms of, it's unofficial, it's not official it's an announcement.
Okay, good. Okay, good.
When we had our advisory council, we always wanted to share what was happening within the queer community, that projects that we're working on that do not necessarily need approval.
Right.
I think it's very healthy for us to be aware of what all of us are doing outside the commission,
Right.
that involve the community. So
Right. And that led to my question. So like even if it's not official support, and say we were to go and like physically support because we wanted, and I do a lot of on the ground like advocacy in places that I'm at physically. And so like I just wanted to know if we got our social media login so we can start.
I currently don't have it. I can try to follow up with some of the former commissioners and find out if anybody has logins. But yeah, thank you for that reminder. I appreciate it.
No problem, no problem. Great, thank you as well.
Also, worst case scenario, I can remake them. We can just start fresh, but I would prefer to start with what we had before. So I'll do my best to hunt that down.
Thank you.
Any other announcements or questions?
did we talk about Black Pride for some, did I miss that?
I brought it up
Okay.
as it's coming up shortly from the 22nd to the 27th. And I will not be able to be there, but I hope everybody that is able to go can go. And yeah, if anybody has any other comment, please feel free to do so.
Is there a way that we can get some materials like so you can't make it and like we can't be there in official capacity?
I can absolutely give materials to other commissioners that might be able to go out. That is never a problem. Julian, I will happily contact you, and I can drop off like what's it called? The cards and handbills and stuff like that.
Yeah.
Any other comments? Sorry to hear my dog jingling in the background.
I don't know if you guys seen this, but in the spirit of announcements, Monroeville Pride is July 27th.
I didn't know that.
Yeah, so
All right.
that's it.
Anybody else? Seeing none, would anybody like to motion for an adjournment?
I motion to adjourn.
Wow. Any second?
Second.
Yay. All those in favor, please say aye.
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 Aye. you. Have a wonderful July. I'll see you all soon. Let me know if you need anything and please stay safe. Thank you.